Hello, my name is Angela Beckerman, and today I'm going to talk about mental health conditions, symptoms, diagnosis, and treatment options. My last couple of blogs have been on addiction and opiate dependency. Today I'm going to focus on mental health conditions. Often when people think of anxiety and depression, they think of feelings and thoughts associated with them. However, there are many physical symptoms related to anxiety disorders and depression. Most people will go to doctors thinking that they have medical conditions when they actually don't. For example, there are people who go to hospitals thinking that they have a heart attack because they have chest pain, a racing heart, and shortness of breath when they actually have a panic attack, which is a type of anxiety disorder. When the doctor indicates that the medical tests are negative, people think, oh, gee, there's nothing wrong with me. And family and friends says, well, maybe it was all in your head. And then people stop seeking professional services and do not get the counseling that they need. This blog will give authors knowledge and education about mental health disorders, but my primary purpose here is to help people with mental health conditions identify some of their symptoms and to alleviate the fear and the shame associated with seeking counseling. In this way, hopefully people will get the counseling they need and have more productive and happier lives. Some people with mental health conditions sometimes are concerned that people will think they're crazy and start treating them differently. The important thing is that it's no one's fault. It's not your fault if you have anxiety and depression. Recovery and becoming asymptomatic has nothing to do with power, weakness, morality, or competency. Most people have sought some type of counseling in their lifetime, and usually on more than one occasion. Even though you have a mental health condition, you can still be a functional, competent, successful, socially respected, happy person, as long as you receive the treatment that you need. There are people who do have some anxiety and depressed symptoms that do not need medication or counseling, and this is because their symptoms aren't chronic or frequent or long in duration, and more importantly, it hasn't affected their life, such as their family, their work, or their social interaction. When your symptoms do affect these areas, it's definitely time to get some professional counseling. Many mental health symptoms are characteristic of psychological disorders that are cause or a result of physical, emotional, cognitive, and social issues. Many conditions have genetic factors, meaning that the condition is passed from one generation to another. Examples of these are anxiety disorders, phobias, depression, schizophrenia, bipolar disorders, and also addiction. Someone who thinks they have a mental condition or has been diagnosed, if they look at their family history, usually there may be one or more family members who have a similar mental health condition that they do. This could work in a positive way because if that family member has the condition, they sought treatment, it was effective, that treatment may be just as effective with you. Psychological conditions can also be a result of an imbalance in brain chemistry that causes anxiety, depression, anger, hallucinations, delusions, and paranoia. Large amounts or depleted amounts of, for example, serotonin or dopamine can create these symptoms. Psychiatric meds that are prescribed by doctors, APRNs, can play a role in balancing these chemicals, brain chemicals, therefore reducing symptoms. So, knowing your family history and taking precautions by recognizing symptoms early and then following recommended medication and counseling can actually help lower chronicity, relapse, and duration of symptoms if it's treated properly and in the early stages. Like your biological factors can affect you emotionally, the stress of prolonged psychological symptoms and conditions can cause bodily ailments. Anxiety can cause headaches and migraines and ulcers, stomach problems, muscle tension. Prolonged depressed mood can affect the immunity against medical problems. It can also cause self-bodily harm, suicide, and death. So we've talked about how psychological symptoms can be physically based. Along with physical symptoms of mental health conditions, there are also thoughts and feelings that are associated with psychological disorders. Thoughts are connected to feelings, feelings are connected to thoughts. So someone who is depressed and they have very low self-esteem and they're very pessimistic and their feelings of failure leads to where they're unmotivated to participate in activities. They have low energy and they have lack of pleasure in doing their usual routines that used to make them happy. So therefore, their lack of activity leads to unachieved goals, which only reinforces their low self-esteem. Now, someone who regrets past things that have occurred to them, they worry. And they worry about many things, most of the time. They will avoid some situations or many situations that trigger fear, and they will avoid situations that would expose them to things that would make them anxious. So again, anxiety and depression can stop participation in activities that would promote the attainment of goals and personal happiness. Thus, anxiety and depressed mood, thoughts and feelings related, can affect the outcomes of behavior. Negative symptoms of anxiety and depression, such as irritability, restlessness, anger, and isolation, can have a negative impact on family and social relationships. Because the nature of different mental health disorders, many of the anxiety and depression symptoms overlap. For example, someone with escalated anxiety and is fearful of situations will also feel hopeless and depressed. Feelings of failure, negative thoughts, and depressed mood may lead to anxiety about the future. Symptoms of bipolar includes mood swings, mania, anxiety, and depression. Hallucinations or delusions of schizophrenia, where someone thinks that aliens are attacking the world, will create feelings of anxiety. Someone with social phobia will have anxiety in social situations or when meeting people. Someone with post-traumatic stress disorder will be depressed when they have flashbacks of past trauma and anxiety when they are triggered in future events that remind them of the original traumatic event. Being able to identify the mental health symptoms and diagnosing mental health conditions helps in selecting a counseling approach, modality, and treatment plan and effective medication for the individual person. So here we've done an overview of the causes of anxiety and depression, some of the symptoms, why people don't seek counseling, the shame, and basically getting beyond the shame so you can get the counseling that you need. So now we can talk a little bit about symptoms of anxiety. Okay, we talked about these disorders as having feelings, thoughts, behaviors, and physical symptoms. Hold on one second as I fix this paper. For symptoms, anxiety, thoughts. Of course, they would be worried thoughts about particular situations or many things most of the time. Unrealistic anticipation of negative outcomes of future events, thinking many things at once, inability to concentrate. This can affect memory. Emotions of anxiety, excessive worrying about resulting in unable to function, nervousness, fear, restlessness. Behaviors, maybe when you see anxious people, you see them tapping, biting their nails, nonstop talking, fidgeting, pacing. Physical symptoms, racing heart, difficulty breathing, shortness of breath, stomach aches, racing heart, difficulty breathing, shortness of breath, stomach aches, headaches, dizziness, and feeling faint. Anxiety symptoms can also include shakes, chills, trembling, numbness, and muscle tension and aches. There are also different types of anxiety. There's generalized anxiety, where someone worries excessively most of the time. Panic disorder is sudden and unrealistic feelings of pending doom. Social phobia is excessive fear of being judged or disapproved from others. Fear and anxiety in groups, social events, or when meeting people. So there you go with the different symptoms of anxiety. Perhaps you yourself or someone you know have experienced these. Symptoms of depression. Let's talk about thoughts that people must have. Usually they're negative thoughts of self, others, and outcomes of events. Emotions associated with depression. Depressed mood, feeling of hopelessness and worthlessness, guilt, low self-esteem, fatigue, loss of interest and pleasure in usual activities. Behaviors, isolation. Usually people who are depressed, they do not want to be around people. Usually their friends and loved ones would say, gee, he hasn't called me for a while, I haven't seen him or her. They'll have slow, low speech, low motivation, very little participation in activity. Physical, difficulty sleeping, falling asleep, staying asleep, early morning wakenings, or sleeping too much, lower or heightened appetite, weight loss or weight gain. So that's the symptoms of depression. Common types of depression. There is something called depressive disorder, where someone may have one episode of depression. There's recurrent depressive disorder, which is exactly what it means. It's when someone has 2 or more episodes. Now, someone who has depression that's lasting for a good few years, but the episodes are not severe and the individual episodes are not prolonged, it's called dysthymia. Post-traumatic stress disorder, which we often hear about in the news when there's a traumatic event in the community, is a difficulty recovering after experiencing or witnessing a terrifying event. Depressed mood and anxiety triggered by flashbacks, nightmares, and memories of the traumatic event. So now we know the symptoms. We know some reason why it's hard for people to seek counseling due to the shame related to it. But again, there are a lot of people, and anxiety and depression is very common. And there's been quite an increase over the years of people who are seeking counseling, not only to reduce symptoms, but because they want happier and productive lives. They do not want to suffer or have their family members suffer. So let's talk about treatment. The first thing that I highly recommend, if you see any of these symptoms, please consult with your doctor. Rule out any medical conditions that may be the cause of depression, anxiety, or any of these psychological conditions. The second thing is certainly medication management. Once a medical condition has been ruled out, a psychiatric eval can be implemented by a licensed psychiatrist, social worker, or counselor, so a diagnosis can be determined for medication. Follow-up for medication appointments are scheduled when medications are prescribed. So now we talked about ruling out medical issues, having medications, possibly considering psychiatric meds. It's not necessarily that they'll be recommended, but definitely an evaluation would be important. Common counseling approaches. I'm going to briefly go over these, as you can definitely go on my website, AngelaBeckermanTherapy.com, to read the written blogs regarding the different treatment plans, treatment counseling practices. One is called motivational enhancement therapy. Motivational enhancement therapy is a cognitive behavioral therapy. What that means, in order first for people to change, they want to have to change. They want to say, gee, I have a problem, or I'm suffering from something that's hurting my hindrance of happiness or my personal goals. So there needs to be a motivation. And the first thing I do in counseling is help people realize what that motivation is. And motivation is the most significant factor in change, in starting change. The second modality I frequently use is cognitive behavioral therapy. Through this video, I have been talking about how, with anxiety and depression, how thoughts are connected to feelings. Feelings are connected to thoughts that are connected to behavior. So part of it is if you change the way you think or you change a behavior, it would change how you feel. So, sometimes we talk about it as talk therapy or self-talk. It's basically known as behavioral cognitive therapy. Another thing I use, particularly with anxiety disorders, is I use breathing relaxation exercises. This is slowing down your breathing that will reduce physical symptoms of anxiety, the fast heart rate, the shortness of breath, and muscle tension. I found this very effective with people who do have a lot of physical signs of anxiety. And it's very interesting when you slow down the physical processes, then your mind is able to think freely, you're able to change your thoughts, and then how you feel. So those are a couple of different treatment modalities that I use. I get more specific in my written blog. So again, thank you for listening to this. And I hope that if you feel that you have any of these symptoms, that you consult with your doctor. Certainly you can call me or email me and ask me any questions. And if you would like an appointment, I could schedule one for you very quickly. So thank you for listening to this, and I hope you're able to use this and also share it with your friends and family. Thank you.